Hello, my name is Elena Lopez. I'm going to be a student nurse. I'm going to show my surrounding areas. I'm going to place it back into position. Okay. So what I'm going to do first is go into the medication room. I'm going to make sure that is a no interruption zone. That means the door will be closed behind me. I will not be on my phone. I will not take any calls. That also means that I will stop all conversations with my colleagues unless it is vital to the medication that I'm giving or finding right now. Okay, so I'm going to start by finding the medication on my patient care order form. So I found heparin, and I need 5,000 units subcutaneously every 12 hours. And then I'm going to go over and look at my medication administration record, which is also called my MAR or MAR. So I'm going to look. I have heparin 5,000 units subcutaneously every 12 hours, and I have heparin 5,000 units subcutaneously every 12 hours. So now I'm going to start my first check of accuracy. So I'm going to start by finding the right patient. Jaguar Jones, medical record number 4176352, medical record number 4176352. If he has any allergies, which he does, penicillin. And on my MAR, it also says penicillin. I'm going to look for the right medication. So I have heparin, the right dose, 5,000 units, the right route, subcutaneously, the right time, every 12 hours, and for the right indication, I would state that heparin is used as an anticoagulant used to prevent blood clots. Perfect. So now I'm going to perform hand hygiene, and I'm going to find the medication that I need. So I need heparin. I'm going to read the vial, and it says heparin is 10,000 units per 1 milliliter. The expiration date is 12/5/25. And I'm going to compare it to my MAR, and it says heparin is 5,000 units subcutaneously every 12 hours. And so I'm going to show the vial of heparin. Okay. And so now I'm going to find my needle that I'll use, and I'm using a TB syringe with a 28 gauge needle. Okay, and now I'm going to calculate the dosage of the medication that I need. So on the vial, it says heparin is 10,000 units per 1 milliliter, and on the MAR, it says heparin is 5,000 units needed subcutaneously every 12 hours. So that means I will need 5,000 units per 0.5 milliliters. So half of a milliliter is what I'll draw up in the syringe. I'll need it subcutaneously every 12 hours. So I'm going to start by getting an alcohol prep pad, opening it up, and cleaning the vial. I will grab my syringe, put it in the trash, and I will draw back to 0.5 milliliters of air in the syringe. I will take the cap off, insert the needle, put the air in the vial. I will then draw back 0.5 milliliters of heparin, and I can go past 0.5 just to make sure there are no air bubbles. Okay. Then I'm going to do the scoop method. Okay. And now I'm going to just verify one more time that this is heparin 5,000 units subcutaneously every 12 hours, heparin 10,000 units per 1 milliliter, and I have 0.5 milliliters in my syringe. I'm going to show the camera that I have 0.5 milliliters. Okay. And next I would have a colleague come and check my dose and my drug. So I would have them look at the vial and the MAR and the syringe for heparin, 10,000 units per 1 milliliter, and I need 5,000 units of heparin, which is equivalent to 0.5 milliliters. So now I'm going to do my second check of accuracy. So I'm going to look at the right patient, so Jaguar Jones, medical record number 4176352, medical record number 4176352. Any allergies, and it says penicillin and penicillin. Now I'm going to look at the right drug, heparin, compare them both. The right dose, which is 5,000 units, 0.5 milliliters. The right route, subcutaneously. The right time, every 12 hours. And the patient has not received the drug or the medication in the past 12 hours. And the right indication would be that heparin is used as an anticoagulant used for preventing blood clots. Perfect. So now I'm going to take this tape, and on that I'm going to write the patient's name, Jaguar Jones, the drug, or medication, which is heparin, and the dose, which is 5,000 units per 0.5 milliliters. I'm going to take that and place it on the syringe so that I can still see the numbers on the syringe and the liquid inside. So now I'm going to take the syringe, the vial, and my MAR, and I'm going to go into the patient's room. So I'm going to go and I'm going to knock. I'm going to say, hello, my name is Elena. I'm going to be your student nurse today. And so I'm going to start by identifying the patient using two different factors. So I'll look the name on his wristband, Jaguar Jones, the medical record number, which is 4176352, medical record number 4176352. I'll look if he has any allergies, which penicillin, and I would ask if he had any other allergies that I should be aware of. He doesn't, so perfect. So now what I'm gonna do is I'm going to do any necessary pre-administration assessments before injecting the heparin, so anything that I would need to do before I injected. And now I'm going to perform my third check for accuracy. So I will make sure I have the right patient, Jaguar Jones, medical record number 4176352, medical record number 4176352. Any allergies, penicillin, the right drug, heparin, the right dose, 0.5 milliliters, 5,000 units, route subcutaneously, time every 12 hours, and patient has not received the medication in the past 12 hours, and also the right indication, which would be that that heparin is used as an anticoagulant used for preventing blood clots. So now I'm going to explain the procedure to the patient. So Mr. Jones, today I'm going to be administering 0.5 milliliters of heparin, which that is used as an anticoagulant used for preventing blood clots. Okay, so now what I'm going to do is I'm going to put on my goggles and my clean gloves. And I'm going to find the injection site. So since this medication is given subcutaneously, you're going to look over the abdominal area. So you're going to make sure not to go past the anterior superior iliac spine. You want to stay below the intercostal margin, and you want to stay above the pubic region. You don't want to go inside that 2 inches around the umbilicus, and so you're going to have a U forming shape, and in that U you want to look to see if you see any bruising, and if you see any poor skin integrity. Okay, so now what I'm going to do, I'm going to take another alcohol prep pad, and I'm going to open it, throw that away, and I'm going to clean the area in circular motions. And I'm going to place the alcohol prep pad where I just cleaned so that I know where to inject. Now I will take my syringe, and I'll take the needle off, and I'm going to pinch about 2 inches of the skin, and I'm going to inject at a 90-degree angle. Now, if I could not pinch 2 inches, I would try and pinch 1 inch of the skin, and if I had to pinch 1 inch, I would inject at a 45-degree angle, but in this case, I can pinch 2 inches, so I will inject at a 90-degree angle. And I'm going to throw that in the Schweppes container. I'm going to hold the pinching for about 3 seconds. And I'm going to move the patient back into a comfortable position, and I'm going to raise the side rails, and I'm going to lower the bed back to the position. And then I'm going to take my gloves off. I'm going to perform hand hygiene, and I'm going to assess the patient. So I'm going to see, just see if he had any reactions to the medication given, allergic reactions or anything like that. And then I would leave, and I would go document the last right of the 7, which is the right documentation. So I would say that I administered the drug, or the medication, which is heparin, the time I gave it, the route, and I would know if there were any allergic reactions that the patient had. And then about 30 minutes after that, I would come back and I would check in on the patient, see his tolerance to the medication that was given, and if there were any allergic reactions that occurred. And that is the end of my medication administration checkoff.